One of the more innovative design concepts that came out of this project was the idea of blending a medical office building, 4 stories of physician offices, with a 2-story hospital platform, essentially, making that connectivity as simple as possible so that patients using or visiting their physicians can come down, get a test done in the same building without leaving. I think it's a great concept. I think it's a concept you're going to see more of.
One of our goals through the entire building is to make sure that the patient knows that we care and that UF cares.
A project like this is important to the community in the way that it provides services. And it's important to UF Health in the way that they'll be able to provide those services and work in an efficient environment. But those activities really are related across a broad spectrum of issues that range from the economy of operations to the sustainability of the building to the quality of the patient experience and finally sort of the portrayal of the facility to the community by the nature of the architecture.
UF Health was interested in creating a design aesthetic that spoke to the state-of-the-art healthcare that they provide their patients. As part of that goal, we proposed a very contemporary aesthetic, and we were thrilled that they had a strong appetite for this type of design. So the large expanses of glazing, the sleek aluminum panels that we use, some of the sort of bold architectural moves with the silver ribbon and the spinning forms that sort of rotate on each other, all sort of speak to the dynamic, state-of-the-art healthcare that UF Health provides. The location of this facility, being right off I-95, is going to be very accessible to many people across North Jacksonville. And I think as people come to use this facility, they're going to realize what a great asset they have right in the middle of their community. Some of the energy efficient strategies we used on this project include low-E insulated glass. What the glass does is it brings in a lot of natural daylighting, so we don't need to use as much artificial lighting on the interior of the building. Also, as part of that, we've dropped some light wells down into the interior of the building. And so we're getting daylight into departments that usually don't expect to see daylight throughout the day. And that's good for staff morale, it's good for wayfinding. The silver ribbon that wraps the exterior of the building creates some really deep overhangs. They provide natural shading to some of this exterior glazing. The design of this building allowed for some really unique exterior spaces. We've got on the 2nd floor waiting area access to a small garden. Also up on the 3rd floor where we have some of the medical office suites, there's another terrace where events can be held. And some of the other interesting areas of the project include the green roof off on the back side of the medical office building. There's 4 floors of physician offices that look down on what is a large roof. And we thought what would be a great way to sort of disguise that roof would be to put a vegetated roof out there. And that's turned out to be a great success.
Well, also another attribute of the healthcare reform is building patient satisfaction. A patient's experience is not an accident. It's a designed activity. And every element of this architecture and the interior design is designed around creating a positive patient experience and also creating a positive experience for families and all the staff. All that's going to go back to the patient satisfaction scores and the rating and reimbursement for this facility. There's a direct relationship between that form of satisfaction and the compensation the facility will be receiving for the care they provide.
My favorite space, I've got a couple, but I think the lobby is definitely one of them. Again, I think it's very inviting, a lot of natural light. Probably women's diagnostic waiting. I think when women have to go through those procedures, there is anxiety there. And so they are brought back into a space that's very inviting. You're right on the light well. It's just very soothing, and it's just kind of takes the stress away. And that was the purpose of women's diagnostic waiting. From a hospitality standpoint, what we created is small gathering spaces throughout the building, different areas for visitors and patients to go to. Technology was one of the main design drivers that we had. All the waiting areas are wired and plug and play pretty much everywhere. So, everybody brings cell phones and computers with them today. We wanted to make sure that they have access so they can work, if a loved one's here. They have wired all of the foot walls in the ED rooms and also the perioperative rooms. They're wired for telemedicine, so those foot walls will become interactive. They couldn't afford the equipment now, but several years down the road, they said yes, they want to do it. So everything has additional wiring for the future.
One of the most wonderful things and gratifying things about being in healthcare architecture is that it's a continuous learning process. What is needed is always evolving, and our responses are continuously evolving to those needs.
We've made every effort to make UF Health North patient and family friendly. And that means not only the care we'll provide, but also the comfort of the patient environment and the unique attributes of the building that enhance the patient and the visitor experience. I think it's the most unique healthcare facility that I've ever seen.
As this community continues to grow, this facility is planning to grow with it. The plans are in place to build a 92-bed inpatient tower in early 2016. When that's completed, UF Health North will be a full-service hospital. This new facility will also help our economy. UF Health North will create 350 new healthcare jobs right here in the city of Jacksonville. 350 new jobs. And so I'd like to thank the team for their vision, their conviction and dedication and commitment to this city to make sure that they provide access for healthcare for those who need it the most.